Good morning and welcome to our weekly briefing. Last week, I mentioned that we might be seeing a peak in the Omicron wave. Since then, we have started to see a drop in the number of new cases identified. I want to be perfectly clear, though, this does not mean that the danger is past. We are still seeing nearly 2,000 new cases per day. 3 weeks ago, that number would have been the worst we'd seen in the entire pandemic. It's only because things are slightly better this week than last week that we're hopeful. I also want to note that seeing fewer new cases per day does not mean that the Omicron wave is over. The truth is that we don't know what's going to happen, but the numbers this week do give me some hope. So let's cover the numbers. In the past 2 weeks, 25,179 Philadelphians have been diagnosed with COVID. As of yesterday, we're seeing an average of 1,979 new cases per day compared to more than 3,500 cases per day last week. And the percentage of tests that are coming back positive now is down to 21%, which means that we still believe that we're missing a significant number of positive cases in the community. The number of people who've tested positive for COVID in hospitals is higher at 1,432 than when we talked last week, but down from a high of more than 1,600. Most of the people in the hospital with COVID are still not fully vaccinated, which means that the best way to protect hospitals and to protect yourself is by getting up to date on your vaccinations. That means that if you haven't had any vaccines yet, you should get your first today. If you're eligible for a second dose, get it today. And if you're eligible for a booster, get it today. Get up to date and start protecting yourself and others today. For vaccines right now, more than 95% of adults, 92.3% of those 12 and up, and 32.2% of children 5 to 11 in Philadelphia have had at least one dose. 78.5% of adults and 72.8% of those 12 and up are fully vaccinated. And I'm happy to report that more than 250,000 booster doses have been administered in Philadelphia. But we still need more. All of those numbers could be and really need to be higher. On testing, I want to make sure that all Philadelphians know that they can order 4 test kits free from the US government through covidtests.gov. There is supposed to be a telephone number soon, but in the meantime, those who do not have internet access can reach out to our call center for assistance placing your order at 215-685-5488. Tests will take a few weeks to ship, so if you need a test now, please go through one of our local sites available at phila.gov/testing. Today, we will be posting new guidance for city schools that is based on the recent guidance from the CDC, taking account of local conditions. Although the CDC allows for an end to isolation and quarantine after 5 days without testing, their guidance also notes that 31% of people will remain infectious after 5 days and recommends that they not eat with others. In adapting this guidance for Philadelphia, the return after 5 days is unduly risky for many schools. Unfortunately, Philadelphia schools suffer from an unfair and unjust state funding formula that means that many of the layers of mitigation recommended by the CDC cannot be attained at all schools. Our latest guidance attempts to deal with the facts on the ground while we commit to advocating for a different and more equitable future. While we all recognize that there are no perfect answers, this guidance is our best current attempt to keep children learning in person as much as possible while keeping children, teachers, and other staff members as safe as possible. Local education agencies that can implement all recommended layers of mitigation can switch to 5 days of isolation or quarantine for students with strict masking for an additional 5 days after consultation with and approval by PDPH, the health department. The required layers of mitigation include ventilation, contact tracing for high-risk exposures, meaning exposures without a mask on, an area where students, teachers, and staff can eat while removing their mask from days 6 to 10 that is separated from others, screening, testing, and strict masking. Local education agencies that cannot implement all of the recommended layers of mitigation must maintain a 10-day isolation and quarantine period for students. For teachers and other staff members, our new guidance allows for return after 5 days if rapid tests are negative on days 5 and 6. So they can return on day 6 after testing negative that morning. We are now recommending that contact tracing be reserved for higher risk exposures, meaning those that occur in unmasked settings such as lunch. Screening testing, so 10% of a school's unvaccinated population should be performed weekly to allow schools to be eligible to follow the 5-day quarantine and isolation guidance. Given the current widespread community transmission occurring at this time, we will no longer use case numbers to determine when to pause in-person learning. Instead, schools will continue in-person learning unless staff absences due to COVID-19 isolation or quarantine require a temporary pause. I want to personally thank all of our teachers, school staff, parents, and everyone else who's working to keep children safe and learning in Philadelphia's schools. I know that this time is particularly challenging for our school communities, given all the disruptions that the pandemic has caused so far. We will continue to look for ways to beat back this pandemic, to keep our children safe, and to come through this together. To wrap up, if you'd like more information about the pandemic and the city's response, you can visit our website at phila.gov/COVID. If you have questions, please call our COVID call center at 215-685-5488. And now I'll turn it over to Zelly to present my remarks in Spanish.
Buenos días y bienvenidos a nuestra sesión informativa semanal. La semana pasada mencioné que podríamos estar viendo un pico en la ola de Omicron. Desde entonces, hemos comenzado a ver una caída en el número de nuevos casos identificados. Quiero ser perfectamente clara. Sin embargo, esto no significa que el peligro haya pasado. Todavía estamos viendo casi 2,000 nuevos casos por día. Hace 3 semanas, ese número habría sido el peor que habíamos visto en toda la pandemia. Es solo por las cosas están un poco mejor esta semana que la semana pasada que tenemos esperanzas. También quería señalar que ver menos casos nuevos por día no significa que la ola de Omicron haya terminado. La verdad es que no sabemos qué va a pasar, pero los números de esta semana me dan esperanza. Entonces, cubramos los números. En los últimos 2 semanas, 25,179 habitantes de Filadelfia han sido diagnosticados con COVID. Hasta ayer, estamos viendo un promedio de 1,979 nuevos casos por día en comparación con más de 350,050 casos por día de la semana pasada. Y el porcentaje de pruebas que están regresando ahora se ha reducido al 21%, lo que significa que todavía creemos que nos falta un número significativo de casos positivos en la comunidad. El número de personas que han dado positivo por COVID en los hospitales es mayor, 1,432, que cuando hablamos la semana pasada, pero está por debajo de un máximo de más de 1,600. La mayoría de las personas en el hospital con COVID, que significa que la mejor manera de ayudar a proteger los hospitales es disponiéndose el día con sus vacunas. Eso significa que si aún no ha recibido ninguna vacuna, obtenga la primera hoy. Si usted es elegible para segunda dosis, consiga la hoy. Si usted es elegible para una dosis de refuerzo, consígala hoy. Ponte al día y comienza a protegerte a ti y a los demás hoy mismo. Para las vacunas, en este momento, más del 95% de los adultos, el 92,3% de los mayores de 12 años y el 32,2% de los niños de 5 a 11 años en Filadelfia han recibido al menos una dosis. El 78,5% de los adultos y el 72,8% de los mayores de 12 años están completamente vacunados. Y me complace informar que se han administrado más de 250,000 de dosis de refuerzo en Filadelfia. Pero todavía necesitamos más. Todos esos números podrían ser y realmente necesitan ser más altos. En cuanto a las pruebas, quiero asegurarme de que todos los habitantes de Filadelfia sepan que pueden pedir 4 equipos de prueba gratis del gobierno de los Estados Unidos a través de covidtest.gov. Se supone que pronto habrá un número de teléfono, pero mientras tanto, aquellos que no tienen acceso a Internet pueden comunicarse con nuestro centro de llamadas para obtener ayuda a realizar sus pedidos al 215-685-5488. Las pruebas tardarán unas semanas en enviarse, por lo que se necesita una prueba ahora. Visite uno de nuestros sitios locales disponibles en phila.gov/testing. Hoy publicaremos una nueva guía para las escuelas de la ciudad que se basa en la guía reciente de la CDC, teniendo en cuenta las condiciones locales. Aunque la CDC permite el fin del aislamiento y la cuarentena después de 5 días sin pruebas, su guía también señala que el 31% de las personas seguirán siendo infectuosas después de 5 días y recomienda que no coman con otros. Al adaptar esta guía para Filadelfia, el regreso después de 5 días es indebidamente riesgoso para muchas escuelas. Desafortunadamente, las escuelas de Filadelfia sufren de una fórmula de financiamiento estatal injusta que significa que muchas de las capas de mitigación recomendadas por la CDC no se pueden alcanzar. Nuestra última guía intenta abordar los hechos sobre el terreno mientras nos comprometemos a abogar por un futuro diferente y más equitativo. Sí, bien, todos reconocemos que no hay respuestas perfectas. Esta guía es nuestro mejor intento actual de mantener a los niños aprendiendo en persona, tanto como sea posible, mientras mantenemos a los niños, maestros y otros miembros del personal lo más seguro posible. Las escuelas pueden implementar todas las capas recomendadas de mitigación, pueden cambiar a 5 días de aislamiento o cuarentena para los estudiantes con enmascaramiento estricto durante 5 días adicionales, después de la consulta y aprobación del Departamento de Salud Pública en Filadelfia. Las capas requeridas de mitigación incluyen ventilación, rastreo de contactos para exposiciones de alto riesgo, una área donde los estudiantes, maestros y personal pueden comer mientras se quitan la máscara de los días 6 a 10, que está separado de los demás, pruebas de detección y enmascaramiento estricto. Las escuelas que no pueden implementar todas las capas recomendadas de mitigación deben mantener un periodo de aislamiento y cuarentena de 10 días para los estudiantes. Para los maestros y otros miembros del personal, nuestra nueva guía permite el regreso después de 5 días si las pruebas rápidas son negativas en los 5 o 6 días. Pueden regresar el día 6 después de dar negativo esa semana. Ahora, recomendamos el rastreo de contactos se reverse para exposiciones de mayor riesgo, es decir, aquellas que ocurren en entornos desenmascarados como el almuerzo. El 10% de la población no vacunada de una escuela debe hacerse la prueba semanalmente para permitir que las escuelas sean elegibles para seguir la guía de cuarentena aislamiento de 5 días. Dada la transmisión comunitaria generalizada actual que ocurre en este momento, ya no usaremos números de casos para determinar cuándo pausar el aprendizaje en persona. En cambio, las escuelas continuarán el aprendizaje en persona a menos de que las ausencias del personal debido al aislamiento o la cuarentena de COVID-19 requieran una pausa temporal. Quiero agradecer personalmente a todos nosotros, nuestros maestros, personal escolar, padres y todos los demás que están trabajando para ayudar a mantener a los niños seguros y aprendiendo en las escuelas de Filadelfia. Sé que este momento es particularmente desafiante para nuestras comunidades escolares, dadas todas las interrupciones que la pandemia ha causado hasta ahora. Continuaremos buscando formas de vencer esta pandemia, mantener a nuestros niños seguros y superar estos juntos. Para concluir, si desea obtener más información sobre la pandemia y la respuesta de la ciudad, puede visitar nuestro sitio web en fila.gov/COVID. Si tiene preguntas, llame a nuestro centro de llamadas COVID al 215-685-5488. Muchas gracias. Thank you.
Thank you very much, Zoe. We'll now move to the question and answer portion of our program. If you have a question, please use the raise your hand function, and we'll take those questions in the order received. As noted earlier, we ask that media outlets coordinate internally and keep their questions focused on today's topic. If there are any reporters who do not get the opportunity to ask a question or have questions about other topics, please follow up with us by email and we'll get you an answer. First up, we'll go to Johan Calhoun from Chalkbeat. Go ahead, Johan. Should be able to unmute now.
Okay, can you hear me now?
Yep,
Yeah.
gotcha.
Okay, the new guidance for city schools, are the changes brought by the drop in cases that we're seeing?
Well, it's a combination. So it was really a response to the new CDC guidance, which if we were to apply it to Philadelphia, would mean that schools could move to 5 days of isolation and quarantine. And some concerns we had and that were expressed to us by a whole variety of stakeholders about shifting everyone to that 5-day guidance.
Okay, does the new guidance change anything at all with student testing?
So yes and no. So, you may have seen a recommendation from the CHOP Policy Lab that screening testing would no longer be needed. We have included screening testing as a criteria for schools that want to move to the 5 days of isolation and quarantine as another layer of mitigation.
Okay, and what kind of relief would the new guidance provide for parents and teachers who are still hesitant, who are still worried about going back to in-person learning?
Yeah, I think one of the main things it provides is that for most schools in the city, we're anticipating that they will end up staying with the 10 days of isolation and quarantine. And I think, I've certainly heard from a lot of parents who have concerns about having kids and or other adults in classrooms who are, day 6, day 7 may well still be infectious, eating lunch with other children, for example, or doing other activities, choir, playing a woodwind, where they're not masked, when we know that there's still a reasonable chance that they're still infectious when they're in relatively close quarters. So it gives some additional security there for parents who are worried about that.
Thank you.
All right, folks, I'm not seeing any other hands raised. Oh, there we go. Ryan Mulligan from Philadelphia Business Journal. Go ahead, Ryan. Should be able to unmute now.
Hi, Dr. Bedigal. I just want to ask, what have you been hearing from restaurants and businesses regarding the vaccine mandate thus far? And is there any discussion yet about when the mandate may end?
So it's actually been remarkably smooth. And this is what we've experienced with other kinds of mandates, that when we actually, in the lead up to implementation, there's a lot of concern, lots and lots of questions. But once people get to the implementation, seems to be relatively smooth. That doesn't mean it's smooth for every restaurant or for every person who finds themselves needing to go home to get their card, for example. But it has been working smoothly. And I apologize, I'd forgotten the second part of your question.
Go ahead, Ryan. You can unmute again.
Yeah, is there any discussion yet about when the mandate may end?
So we're not yet at that stage. So, we're just shy of 2,000 cases a day. Just for perspective, the previous peak, the worst part of the pandemic, we hit about 1,000 cases a day, and very briefly. So we are still in the thick of it. The fact that we're down from over 3,000 cases a day is certainly encouraging. Our emergency departments are not as full to the seams as they were. Things are better, but we're a long way from safe right now.
Anything else, Ryan?
No, that's it. Thank you, Dr. Bedigal.
Thank you. Next up, we're going to go to Nina Feldman from WHRY. Go ahead, Nina.
Thanks so much. Hi, Dr. Bedigal. Just a couple clarifying questions. So you said there's no case threshold for schools to close anymore. So So that would be, so are there circumstances under which an individual school could determine that they wanted to close at this point?
Absolutely. What we're saying is that, most of the transmission right now, and it's at very high rates, is out in the community. So it doesn't make sense for us to use just a flat number for schools and say at this number you close, because, it may be that they have fewer cases than the surrounding community. But for schools, and they should work, most schools are part of either the school district or an organization. They should work with their central administration. If they are either experiencing staff shortages because staff are out with COVID or out quarantining, or, I could imagine a school that has so many cases among its students that it decides it makes sense to temporarily close. The difference is that we would not be closing the school in that sense or recommending that they have to close. It's more of a kind of a functional assessment of where things are right now. And hopefully as cases come down, that will be less necessary.
Got it, that makes sense. And just quick follow-up. So the 5-day, or the option to go to the 5-day isolation and then switch to all the kind of layers of protection that you mentioned, that's for students and teachers. That's for everybody in the school?
Right, so it's not a school by school, it's a local education agency. So it could be the School District of Philadelphia, it could be a charter entity, but they would make their decision together, consulting with us and with Health Department approval about whether they can really meet all of those layers. But if they can, they could make a decision, and it would be for everybody. Now, we are including, even for schools that don't go to the 5-day, the ability to test to return. So 2 negative rapid tests on day 5, day 6. Second one, obviously you do first thing in the morning, and then you could go back if you were negative twice.
Okay, but just making sure that applies to the student population and the staff and everybody.
So the 2 tests to return is just for the staff. I don't think right now that we have enough tests available really anywhere in the country to do that broadly, but as a way of keeping staffing, as a way of keeping the schools open, that is an option. So they would have to be negative on 2 tests, one on day 5, one on day 6, to go back at day 6 for school staff.
Okay, got it. But the 5-day, the switching from the 10-day to the 5-day, that is applying to students, correct?
That would apply to students, but only at a local education agency that is able to meet all those layers of mitigation.
Right, okay, got it. And then shifting gears, just one question about testing capacity. Can you kind of characterize that for Philadelphia right now? I mean, 20% positive is still really high. And so I'm wondering if you can kind of describe the landscape for testing right now and kind of what the city's doing to bolster it, right, if anything.
Yeah, so it's better than it was, but still people are struggling to find a test when and where they need it. Our new FEMA site in Southwest Philly still has capacity, so that site can do up to 500 tests a day, and it's been running more in the 250 range. But Southwest Philly isn't close to everybody. At philly.gov/testing, you can find a variety of sites available. And then there are the tests that you can order through the covidtest.gov site. Those will not arrive until early February, but I would recommend that everybody order them, because what you really want is having these tests in your house. So if you need one, you have one. So that's 4 test kits. For a family, it's, you're talking 1 per person, so not a lot. There's also the ability for people who have private insurance to get their tests reimbursed. I think there's still a lot to get worked out to make that easier for people to use. Right now, people are being told to save their receipts and potentially even to save the boxes that the tests came in. And you need to choose a test that's on the approved list. So this takes a little research right now. It's not the simplest to use. We are in conversations with state Medicaid about Medicaid covering over-the-counter tests, home tests without a prescription, which would be very, very important for many Philadelphia families. So lots in the works, but right now, philly.gov/testing will give you information about test sites near you.
Thank you.
Thank you very much, Nina. Next up, we're going to go to Jason Laughlin from the Inquirer. Go ahead, Jason.
Hi, thanks for coming to me. A couple quick questions on the overall arc of this current surge. The Associated Press had a story today that was saying that nationally, the death toll from Omicron could still be enormous. It looks like deaths in Philly are starting to go down a little bit. Do you get the sense that we may have dodged the worst of fatalities, or is it too soon to make a call on that?
I mean, I would word it differently. You know, deaths in December were definitely up from deaths in November, up by about 60%. Deaths in January may be up more than that because, you know, there's a lag with COVID and we've had so many cases. We have done a lot in this city to protect our elderly and especially our residents of long-term care facilities. And although we are seeing some deaths in those sites, it's nothing like what we saw in the worst of last winter. You know, Omicron, I think it's been difficult for people to wrap their heads around this. It is milder. It clearly is milder than previous variants, but because it is causing so many cases, we will lose more residents this month, possibly into February, than we have with, you know, over the last 6 months.
And you mentioned the booster shot numbers, and that's a pretty significant minority of people who have had the 2 doses of Pfizer and Moderna or their J&J dose. Why do you think it is that so many people who were fully vaccinated haven't gotten a booster? And is there anything the city's doing to get that number up?
Yeah, we've been doing a lot to encourage boosters, you know, sending people reminders, working with the long-term care facilities to encourage them to boost all the residents who are willing to get boosted, to boost their staff as well. It's, you know, it's interesting. It is across the board, but we're seeing more people getting boosted who are white. It's not necessarily the elderly who are getting boosted. About a third of people getting boosted are over 65. And we are doing everything we can to promote those and to make sure our vaccine clinics are accessible geographically, accessible in terms of hours, you know, to partner with community groups who can help to kind of connect people. And then we're working with Philly Counts who are going door to door, talking to people about boosters and really having those conversations. People have heard a lot about vaccine, but less about boosters. I think there's a certain amount of feeling among people who got vaccinated of, I got side effects from the first dose or the second dose, don't know that I want to get that booster and feel that way again. But with Omicron, we really need the boosters to be fully protected. And, you know, a sore arm, a little bit of headache, you know, fatigue for a day or two is not a bad price to pay for that safety.
And lastly, at what point would you feel more confident, you think, saying, yes, this downturn is permanent and we are seeing a clear arc of the Omicron surge?
I mean, I think if we learn nothing else from this pandemic, like, we have what we have today. And we have a graph that's dropping sharply today. Will that continue? It depends on how people behave, among other things. So, you know, what we saw over Christmas was a lot of people getting together with others, being really tired of restrictions and not necessarily doing that safely. We didn't see that over New Year's. And so, you know, that gives me some hope that people are understanding that this is dangerous. But it really depends what we do next. And, you know, can we do our gathering outside, you know, go for walks or sit outside with people on the warmer days and try to avoid those indoor gatherings? I think it's up to us.
All right, thanks very much.
Thank you, Jason. We're going to try to squeeze Carolina Rodriguez Plaza from Univision in. Go ahead, Carolina.
Good morning, everyone. Thank you for taking my question. Dr. Bedigal, I have few questions for you. Can you give us a little bit of insight of Flurona in Philadelphia?
So Flurona really just means people getting the flu and COVID at the same time. And, you know, it's essentially a reason to get your flu shot as well as your COVID vaccine, because, you know, getting the sort of double whammy of both viruses is something none of us need. But it isn't a separate virus. It's just the idea that these viruses can hit at the same time.
If I test positive for Flurona, can I take the COVID pills to treat it?
So again, it's 2 separate viruses. It's the flu and COVID virus. So the COVID pills are in very, very short supply. You know, they're intended for people who are exceptionally high risk, but even for people who are very high risk, there aren't currently enough doses available. It's only available at a few pharmacies in the city.
That was going to be my next question. What about COVID pills in Philly? What's the inventory, and what is your advice in order to, get people vaccinated or get their pills? What is your advice?
I mean, certainly vaccine is readily available and protective. The pills are a backstop once we have more of them. My understanding is there were 2,000 doses distributed across the state of Pennsylvania. We are having close to 2,000 cases of COVID per day in Philadelphia. So you can see there's not nearly enough of the drugs to help protect us. So I would definitely encourage people to get their vaccines.
Thank you.
Thank you very much, Carolina. Unfortunately, folks, we have run over time. So I'm going to have to end today's briefing. I'm reaching out to the folks who have their hands raised. Hopefully we'll be able to get you guys an answer today. Just a reminder, this briefing is usually held weekly on Wednesday mornings. Details on next week's briefing will be issued by Media Advisory. Thank you all for joining us, and thank you for asking questions. Have a good day.